Hello everyone, welcome to my presentation, An Analysis of Moral Distress in Social Work. This presentation has been created as a course requirement for SOC 445, Practice Realities, Building Knowledge, Skills, and Professional Resilience. So let's begin. This presentation will explore the definition, cause, symptomatology, impact on practice, and methods to confront moral distress. Due to societal inequalities and corruption, moral distress is a reality all social workers will stumble upon in their career. It is a sort of hazing into the reality of social work, a profound awareness that the protection of the morality and ethics in the textbook does not always extend to the workplace. Real social work is a muddle of context, authority, circumstance, resources, bureaucracy, and an imbalance of power. Moral distress, though psychologically, emotionally, physically painful and unjust, ironically is a rite of passage that allows a social worker to develop courage and resourcefulness. In layman's terms, it is the awareness that those in authority often do not play by the rules, and if you confront them, you face negative repercussions, and if you obey them, your client suffers. Moral distress was originally identified by Andrew Jameton in 1984, a bioethicist who focused on nursing practice. Jameton described moral distress as when one knows the right thing to do, but institutional constraints make it nearly impossible to pursue the right course of action. As any other social concept, the definition of moral distress is continuously redefined. Nathaniel, 2002, defines moral distress as the pain or anguish affecting the mind, body, or relationships that a person feels in response to a situation in which the person is aware of a moral problem, acknowledges moral responsibility, and makes a moral judgment about a correct action, yet as a result of real or perceived constraints, participates in moral wrongdoing. Mantari van der Kuip 2016 offers a social work-focused definition of moral distress, describing it as a work-related malaise that develops when a social worker cannot practice in a morally appropriate way because of internal, personal, or external, institutional, organizational, and other context-related obstacles. Moral distress should not be confused with ethical dilemma. As Weinberg 2009 explains, an ethical dilemma is when you are forced to choose between actions that have equal merit with both positive and negative consequences. Moral distress, on the other hand, is when you can identify the morally right course of action, but are blocked from pursuing it by factors outside the self. Moral distress is caused by structural, systemic, and societal inequalities. Researchers Mantari van der Kuip 2016, Oliver 2013, and Weinberg 2009 all agree that economic instability has resulted in governments adopting neoliberal policies that focus on cost-cutting and austerity, especially for public services. As a result, social work has adopted a business model approach, where social workers face ever-increasing budget constraints, deliberate under-budgeting, and pressures to be more efficient under conditions of constantly shrinking resources. Mantari van der Kuip 2016 explains that this cost-cutting might lead to tragic moral decision-making at the front line. Being forced to deny resources and support to those who are in need will lead to moral distress. The problem, according to Mantari van der Kuip 2016, is that social workers have multiple accountabilities to their clients, colleagues, employers, the law, and society in general. Naturally, these multiple accountabilities will sometimes collide. When these accountabilities collide, the social worker is put in a helpless position to cut costs, and costs are often cut at the expense of vulnerable clients. This sets the platform for moral distress. Mantari van der Kuip 2016 and Weinberg 2009 both recognize the lack of autonomy within the social work profession as a source of moral distress. Weinberg 2009 identifies globalization and its ruthless competitiveness to be the source of this demise of social work professional autonomy, with management maintaining more centralized control changing social work from a practical moral activity to one that is rational, technical. Oliver 2013 explains that this top-down decision-making prevents the kind of personalized, responsive, and contextually aware practice promoted by relational ethics. A social worker denied autonomy cannot advocate for a client and implement moral decisions, especially when governed by a competitive business framework. Jaskela et al. 2018 conducted a qualitative study which revealed 4 core moral distress causes, which were other healthcare professionals, caseloads, external resources, and internal rules. Let's explore them in depth. Other healthcare professionals induced moral distress in social workers when they had unrealistic expectations, asked social workers to perform tasks outside their scope of practice, or tasks that other professionals did not want to do, made inappropriate requests, negatively judged patients, which impacted their care, denied patient autonomy, and told social workers not to assist certain patients. According to Jaskela et al. 2018, these latter actions of other healthcare professionals caused moral distress in social workers because they prevented social workers from fulfilling their role and responsibility. In their research, Jaskela et al. 2018 identified unmanageable high caseloads as a source of moral distress for social workers because they prevented advocacy work, which is the root of social work. Factor external resources identified in the study by Jaskela et al. 2018 focused on the constraints imposed by external agencies on clients, such as a strict eligibility criteria or a lack of availability. The moral distress arose when clients had to be denied services because viable solutions were unavailable to vulnerable clients due to scarcity and red tape. Internal rules were the rules of the workplace that led to moral distress, such as being forbidden to assist family members of patients or prevented from sending email messages to patients and their families to facilitate communication. Like a disease manifests symptoms, moral distress also has a unique symptomatology. According to Austin et al. 2013, moral distress evoked anger, anxiety, a sense of powerlessness, guilt, and a feeling of being cut adrift, often accompanied by crying, loss of sleep, nightmares, and a loss of appetite. In Stevenson and Warner-Stidham's 2024 research, they documented the following symptoms of moral distress: anxiety, depression, irritability, anger, fear, tearfulness, sadness, frustration, guilt, shame, withdrawal, religious questioning, distrust, and a loss of meaning. Austin et al. 2005 described physical reactions of moral distress, such as sweating, headaches, nausea, diarrhea, and crying. Feeling angry, frustrated, depressed, ashamed, embarrassed, heartsick, grief, miserable, in pain, sad, and ineffective. Other symptoms of moral distress noted by Jaskela et al. 2018 are self-doubt, when social workers are unable to fulfill their role, and also the act of becoming withdrawn from family and personal connections. Moral distress has a lasting impact on the individual social worker's interactions with their clients and on the profession. Moral distress thrives in climates of haste and control, which negatively influences the identity of the social worker, who operates out of fear and becomes drone-like because they are socialized to follow orders, out of fear of losing their jobs, resulting in self-doubt and a lack of courage. Jaskela et al. 2018 explained that moral distress impacted the practitioner-client relationship, with social workers distancing themselves from the patients and not advocating as much as they typically would. There appeared to be a loss of empathy. Practitioners would seek compromises and act subversively when in moral distress. Antari van der Kuip 2016 adds that moral distress makes social workers unable to do their work as well as they wanted to and were compelled to work against their professional moral code, along with experiencing impaired work-related well-being. Moral distress destroys the social worker's professional identity by depleting their enthusiasm, inspiration, pride, and vigor related to their work. Moral distress causes a profession that is founded on advocacy and empowerment to be reduced to gatekeeping resources, monitoring client behavior, and managing risk. Both Giskela et al. 2018 and Mentari van der Kuip 2016 provide evidence that moral distress results in increased sick days and a high job turnover rate in the social work profession. Giskela et al. 2018 explains that social workers who reported leaving a position had done so because they believed that they had been unable to fulfill their professional role competently and effectively due to various constraints. How can social workers confront moral distress when their profession is dominated by a neoliberal agenda to cut costs and limit practitioner autonomy? While the social justice values of social work make it imperative that social workers rock the boat, challenging the status quo, which impact adversely on people, it is a well-known fact that whistleblowing results in serious and pervasive forms of retaliation by the employing organization, with whistleblowers having to leave their guilty employer for their safety. So, what can social workers do? A literature review reveals a variety of approaches. Oliver 2013 provides a solution of ideals with safe spaces within the workplace for practitioners to talk out moral distress, identify the conflicting components, and reach collective solutions with supportive peers. This act of naming and processing moral difficulties brings the individual burden to a collective responsibility, thereby creating a moral community that helps in keeping ethics social and guards against the slide into individual moral relativism. This entire process of identifying and dissecting morally distressing situations requires practitioner reflexivity, which involves critical self-awareness and analysis of knowledge-power relations and critical self-awareness in the context of social change practices. Lynch and Ford 2016 build on this concept of practitioner introspection and critical self-reflection, which help in identifying value conflicts or differences in expectations and offer modalities such as reflective journals, narratives, case studies, storytelling, dialogue, and peer mentoring or role modeling to develop ways of coping. Social workers often have a fear-based relationship with management, but when they practice self-reflection, they are better able to articulate their concerns. And this act of constantly engaging decision makers is another way to confront moral distress. This can be done by email, speaking up at planning meetings, and speaking to managers, decision makers, and local counselors. In order to engage with decision makers, social workers need to be comfortable and fluent in social policy and not view it as macro-level activities outside the scope of their day-to-day practices with service users. According to Lynch and Ford 2016, being educated in policy allows social workers to confront moral distress by becoming bilingual, by strategically employing managerial language to funders, but using a more explicit social justice discourse with the people and communities with whom they work. This use of strategy and social awareness allows social workers to maneuver around privileged places in the workplace and voice their concerns about moral distress by joining activist groups, signing petitions, and participating in protest rallies. And as a result, they become aware of their political voice and demonstrate what might be achieved by groups coming together to tackle social injustice. These latter approaches to confronting moral distress are quite docile and work within a framework that is not viewed as a threat to employers. These approaches are successful if employers give social workers safe spaces to work out their concerns. Unfortunately, this is far from reality. So what happens in the real world? Giskela et al. 2018 conducted a study to explore the causes of moral distress for healthcare social workers and how the distress affected them. They noted that when social workers were confronted with moral distress, they utilized disobedience. Internal rules were ignored if they were perceived as harmful in order to put the client first. Resourcefulness and creativity, as they fought obstacles that stopped their patients from getting the resources they needed, even if it meant pushing the rules or going in the back door. Power, advocacy, and privilege to support clients despite severe consequences. Mary, a participant in the Giskela et al. 2018 study, explained her reasoning for not following the rules, and she says, So yeah, I was concerned, but in my heart I knew what was right. And I think that for social workers, the dilemma is, in your heart you know this is the right thing to do, but the system does not allow that to happen. But where you come from, a place of advocacy, you come from a place of care and support to the patient and the family, and it's all about that. And so that's why I think we make those decisions to not follow the rules. Cabin 2008 identifies three types of social workers: the conformist, the innovator, and the rebel. When encountering moral distress, the conformist is the ultimate organization person taking the agency's corporate care guidelines as gospel, regardless of patient need. The innovator is like the social worker who bent the rules in the Jaskela et al. 2018 study. According to Cabin, the innovator social workers are the ones who attempt to find flexibility in corporate guidelines. They advocate, they research, and they find the gray area. Cabin 2008 describes the rebel as one who is not intimidated, for whom the end justifies the means, who is not bound by rules but instead a deep motivation to help their client even if it means negative consequences or personal sacrifices to themselves. The final approach to confronting moral distress is one of moral courage, which is the ability to stand up for the right thing or to do the right thing when some negative repercussions for the right doer is anticipated. Moral courage is when Cindy Blackstock filed a human rights complaint in 2007 against Canada, alleging racial discrimination against First Nation children by underfunding child welfare on reserves. She immediately experienced financial, social, and legal repercussions from the Government of Canada, to the point that she and her family members were spied upon, and Indigenous leaders were ostracized by the federal government if they associated with her. Blackstock 2011 explains that fear is a key tool in the bureaucratic arsenal to keep questioning employees in line, with the tried and true threat of "we pay your paycheck." And she reflects that when I allowed my values to usurp these concerns, I set myself free. Blackstock 2011 advises that moral courage cannot be based in self-interest, ambition, unresolved issues, and weak research. Instead, moral courage requires an individual to understand their moral values through practice and reflection. Moral courage is demonstrated through courageous conversations, which is the ability to publicly stand your ground on your personal and professional principles and/or values in situations where such expression is likely to be challenged. Courage is not a New Age concept. In fact, in 1907, Dr. Peter Henderson Bryce went public with shocking revelation that over a third of children placed in government-funded and church-operated residential schools were dying there. This act of courage was during a time when Indigenous people were considered wards of the state and were denied the equal human rights as white settlers. The residential schools were a socially accepted institution at that time. Despite Canada's efforts to dismiss or discredit him, Dr. Bryce continued his advocacy for Indigenous victims of residential schools. Blackstock 2011 explains that Bryce stepped up his advocacy, reaching out to leading human rights lawyers such as S.H. Blake, who famously said, "In that Canada fails to obviate the preventable causes of death, it brings itself into unpleasant nearness to manslaughter." Blackstock 2011 reflects, "Oppression, I have learned, does not like a witness." Social workers are everyday witnesses to acts of injustice and oppression, and just like Dr. Bryce, they have a degree of authority, power, and a skill set which they can use to amplify moral indignation. This means having thorough documentation, doing the research, speaking up at meetings, and escalating concerns to higher authorities when organizational superiors refuse to take action. If these actions prove futile, then one must garner public participation, as Blackstock 2011 did with the human rights case of 2007 against Canada, alleging racial discrimination against First Nations children by underfunding child welfare on reserves. Out of this case was born the I Am a Witness campaign, which invites Canadians to follow the legal cases on a resource-rich website that posts all legal documents, including testimony, for everyone to read. Moral courage is a universal concept. You do not need a degree or formal education to embody it. A case example is Shannon Kustachin of Attawapiskat First Nation, a 13-year-old who lobbied the Canadian government to replace the broken down portables sitting next to a toxic waste dump that passed for a school in her community. When Shannon's appeal was rejected by the Minister of Indian Affairs, she did not give up. Instead, she used social media to spread awareness and asked the public to participate in the Attawapiskat School campaign. Shannon's determination resulted in letters from thousands of children, young people, and supporting adults demanding safe and comfy schools and equitable education. It seems that moral courage also requires determination and an ability to see the utility in resources most accessible to you. Moral distress is a reality born out of our current political circumstances of neoliberalism, cutbacks, and dismantling of public services. It is a tool used by those in power to subjugate and control social workers through fear of job loss and reprisals. There are many approaches social workers have used to confront moral distress. Each carries a risk and benefit. Moral distress is overcome when the fear of repercussions is overcome, when community collaboration and action is implemented, and this requires time, skill, peer support, and courage.